Welcome everyone to our first PO call of the new year. Happy New Year to everybody. What we're going to go over today, so we have some brief VBR updates that we'll cover. We'll talk a little bit about the dashboards in 2026, what you can expect, some enhancements that we're planning to do. We'll talk about the updated HEDIS 90th percentile A1C rates, an update on recruitment, talk a little bit about the spring 2026 regional meetings and site visits, our PO small group calls that are in the process of getting scheduled, our work group updates, and then touch on where we are with our pre-diabetes work and give everybody an update on that. So as far as the PCP VBR year, as you all should know, we gave extra credit to any practice who completed their physician level and practice level learning community activities before January 1st. We had 63 practices take us up on that. Our goal with this was to reduce both burden on you at the end of the year and burden on us at the end of the year when everyone's trying to complete those all at once. So decided to try this out. I feel like it went really well. And we had good engagement with this, and hopefully it will be of help to those practices as well. And, if something else comes up where they have to miss a requirement, they're able to have that little bit of buffer there. And then everyone else who hasn't met those yet, all remaining physician level and practice level learning community requirements are due on July 1st, similar to last year. And then we're working on keeping our learning community activities menu on the admin portal up to date so that when new opportunities get added, they're reflected there. So that can be kind of a one-stop shop for you to share that out with your clinical champions and for your clinical champions to share with their practices. So, for example, last week we distributed the CGM workflow survey opportunity. So any practice who has a really good workflow in place around getting CGM data to physicians before a patient's seen for an appointment is eligible to fill that out. And then we're hoping to build out best practices to share with the collaborative as a whole off of that. That'll be mentioned on the learning community activities menu, as well as like the current tools for review, et cetera. I know we've had a couple questions about when registration will be available for learning community events, because I'm sure at the start of the year, some sites may be wanting to send out, like, this is everything that's coming up with MCT2D and with the other programs that your sites participate in. We have the dates and times confirmed for 8 of our learning community events. We're getting the registration for those set up, and we'll have those by the end of the week for all that are scheduled. We're hoping to get those last couple fully confirmed and scheduled as well so that we can send out registration all at once. And then please encourage your physicians to sign up in advance so they're set to meet that requirement well before the deadline so that no one's scrambling as we get towards the end there to meet that. And as always, we'll continue to offer CME for those events for physicians, nurses, pharmacists, dietitians, though it does need to be the physician who is attending to get that physician level learning community requirement. And these are the 8 that we do currently have scheduled. So like in the past, we have a wide variety of topics. A lot of these came directly from requests from the collaborative as part of the fall regional meetings. So we're doing the updates to ADA standards of care again. We're getting into more things on low carbohydrate diet, as there's always a lot of requests for that, including myths and facts and like a stepwise approach to how you talk through it with the patient. We have mental health and diabetes distress, an overview to DSMES. So a lot of great topics and new things that we haven't covered in the past for the collaborative. And then we have these couple that we're still working on getting exact dates for around food as medicine approaches, the cardiac rehab and diabetes management, and then new obesity and diabetes medications. Speaking of VBR opportunities, we do have one tool that's currently available for feedback, and I wanted to mention this on here so that we can get feedback before the next round of reporting is done. So we sent out initial performance reports back in November, both to the POs and then practice level ones that were via the admin portal, so that it's not falling to you as the POs to distribute these to everybody. Hopefully that's been helpful. Both POs and practices are eligible to fill out the feedback survey on the performance reporting, and we really encourage you to do so because we want to make sure that these reports are useful and actionable for you. So if there's things that you can think of that it would be helpful to see or helpful to have it reported differently, this is your opportunity to do so. And then for physicians, completion of the survey will meet their physician level learning community requirement as well. So there's that benefit there for them. This last bullet on here, I need to slightly change. So next performance reports, the ones for A1C will actually be distributed in February. And then the ones for PCP, UACR, nephrology, UACR, and endocrinology, UACR will be distributed in April. So it would be great to get your feedback before then so that we can ensure that these reports are as useful to you and to your practices as possible. So I'm going to switch to some of the updates on the patient data dashboard. So as many of you have seen, likely, we've added the visualizations for each of the performance measures as of the release that was done in mid-December on the 19th. This also includes an update of the data. So through October 31st for the Blue Cross claims and clinical data and any of the clinical data as well. And then the Medicaid claims data is now through the end of September. So that is along with those updates of the visualizations for the performance measure. And to give you an update on the dashboard release schedule, so since it was the start of the year, just wanted to cover what you could expect with this throughout 2026. So this is our estimated dashboard release schedule. It usually ends up being fairly close to these dates that are here provided via MDC. So we have both when the release date is, and then these are the releases that will have a progress report based on them. So this release is coming out on the 30th, and then we will do a progress report following it in February. This release is on the 31st. She'll be followed by a progress report in April. And we've noted like what the progress reports are for that. And then the final report for the A1C measure will be available after the update in June. And yeah, we expect these to stay fairly close to this throughout the year. And while we're only doing push reporting on the dates that are noted here, the dashboard will update. And like we just said on that previous slide, with the performance measure visualizations included, you'll be able to get some interim updates for you and your practices when signing into the dashboard between the reporting provided by MCT2D. And this is what we're planning for updates to the data dashboards in 2026. So we're adding additional diagnosis fields to make sure that we're capturing every patient with type 2 diabetes so that we're more comprehensive and accurate with our population that's captured there. We're also adding eGFR to the summary measures page as well so that we're able to get more information to you. And that's another metric that's included as part of HEDIS. So it'll be helpful to be able to know and easily access. In the second quarter, we're going to be adding patients with prediabetes to the inclusion criteria and including them in the extracts for the data. So we're expecting this by June 2026 that we're able to incorporate that. And this is in support of our prediabetes initiative that we'll give some updates on later in the presentation. We're also making improvements to the way that certain variables are categorized and displayed on the dashboard, just for your ease of use, your ease of finding things. In the third quarter, we're completing the dashboard redesign. So hopefully updating the patient list and the patient profile pages so that they all have that like nice look and feel of our summary dashboard page that Laria and our design team have worked on. And then in the meantime, as we'll get to on the next slide, we'll have some focus groups where we get your input on what those pages look like and how we do that dashboard redesign. In quarter three is when we'll have that inclusion of the prediabetes patients into the dashboard instead of just in the extracts that we receive. And then in the we'll be also adding any new performance measures that we include to the dashboard as well. And then in the fourth quarter, we'll be adding race and ethnicity to the dashboard. We are planning a one-off like report on race and ethnicity that we'll be distributing within the next month or so to each of the POs. And by the end of this year, we'll be incorporating some information about that in the dashboard. And we'll also be receiving patient zip codes in the extract as well, which will allow for some like additional analysis on our side, especially around things like health disparities or accesses to resources in the community. And related to the development of the data dashboard, we are hosting and sent an email about last week our PO focus groups related to the dashboard development. So the dates for these are listed on this slide. So we have one in March, one in April, and one in May, each on different days of the week so that hopefully we can find one of these that works well for each of the POs. This is a PO scorecard requirement, so we do ask that someone from your PO attend. So it doesn't have to be like the admin lead necessarily. It can be a PO primary contact. It can be someone at the PO who's like interfacing with the data and the dashboards the most, who can give that input on it. So this is where we'll be working with you to make sure that the redesign that we're planning meets your needs, and that we're able to take your input and incorporate it. We did this with the summary measures page, and we're able to make some changes that we think made it really beneficial to the users of the dashboard, and are looking forward to getting your feedback on that again. Also wanted to share that we did receive the updated HEDIS rates from Blue Cross Blue Shield for the A1C measure. So if you recall, when we launched the measure, Blue Cross Blue Shield asked us to hold off on setting specific targets because they wanted us to ideally align these with the updated HEDIS 90th percentile rates and the 4-star rate for CMS for Medicare. So we received these in very late December, and we're working on an analysis internally to see how practices are performing compared to these new rates. Because as we said to you at the time, we don't want to have a rate come out and have it be that half the practices in MCD2D aren't meeting it. So we want to ensure that these target rates are fair for the collaborative, and that's what we're looking into right now. But the updated rates are 74.45% for commercial patients. So the previous 90th percentile rate was 70%. This represents an increase of 4.45% off of that previous target. And then for Medicare, the new CMS 4-star rate, which essentially is equivalent to that 90 percentile, is 91% of patients. Last year's target was 87%. So a similar increase to the commercial population of about 4% there as well. So more to come. We're hoping to have information to share with you shortly on this, ideally before the end of the week, because we obviously wanted to have a target in place as soon as possible. We were hoping to have something to share with you in November, but due to the government shutdown and other slowdowns, we didn't get these rates until later than expected, but we'll be sharing this with you as soon as we can. And then switching gears a bit to the spring regional meetings. So these holds have been on the calendars for the clinical champions, I want to say, since last summer. So everyone should have a hold on their calendar for these dates, and they're listed on this slide as well, following a really similar cadence to what we've done in the previous years, starting in the second week of April and wrapping up in the second week of May. We have all of the locations confirmed, all of the dates confirmed. And we're going to open registration for the regional meetings likely in early to mid-February. And as always, for these spring regional meetings, we would ask that the PCP clinical champion, the endocrinology clinical champion, and the nephrology clinical champion from all of the participating practices attend. We'll keep that same structure where the specialists have their own specialty clinical champion meetings in the fall. And this is an overview of the agenda that we're planning for the meeting. So we plan to begin and spend that first 30 minutes on updates, since when we've done evaluations of the meetings, this is always one of the topics that people find the most helpful, is to just know what's going on in the type 2 diabetes space, know any coverage changes, know any relevant clinical updates. We'll likely cover some of the changes from the ADA updated guidelines and new medications that are coming out, similar to what we've done in that first 30-minute section of the majority of our past meetings. We then want to have a more discussion-oriented portion of the meeting for about 30 minutes, where we'll focus on like future performance measures. So, in the past, we've worked with the steering committee and have worked internally to determine like where we want to focus. And we're hoping to bring the collaborative more broadly into this discussion. So we wanted to talk through some of the different things that we're thinking about and hear from the collaborative what's of interest to them, what challenges they see with certain measures, any considerations that we should have like as making those determinations. So we're going to incorporate that into the regional meetings for this year. And then another thing that we've continually heard as being very beneficial for the practices is to hear from directly endocrinology and nephrology. So we're planning to keep that as a component of the spring regional meetings. And one thing that we're doing a little bit differently this year is we're going to focus these on very case-based discussions, like for each, so that we're walking through specific patient examples and talking about how we may want to think about them and handle them, The endocrinology one will be focused a lot on co-managing patients between primary care and endocrinology. We're hoping to source specific examples of cases, not just like from our clinicians who present, but from the participants in the collaborative as well. So we'll be reaching out to our endocrinology and nephrology practices for examples or thoughts about cases to cover for these. For nephrology, we'll be focusing on patients with cardiac kidney metabolic syndrome, because those are going to be patients with a lot of shared management amongst different specialties and PCPs. So we thought that would be a good place to focus on where everyone could benefit. Also in the spring, we'll be conducting site visits again in the 4 regions that our team travels to versus like what are the 3 more local regions to us. So we're going to be doing them in Kalamazoo, Grand Rapids, Saginaw, and Traverse City. We're going to send out applications for the site visits for those who are interested in February as well. These also meet the practice level learning community requirement to participate in one of these. But more than that, they've been really helpful and really well received from the practices who have participated in these. We tailor the agendas individually based on what the practice wants to talk about. So if someone's really interested in the data and dashboards, we would spend the majority of time walking through that with them. If they have a larger clinic where they haven't been able to disseminate as much of the information about the tools and resources that MCT2D has, we've hosted sessions where we offer like a full intro and walk through the resources. As you can see from this comment here, you know, in this practice, it was a larger one. A lot of the practice had heard of it, but didn't have a full understanding. But through the visit that we had with them, we're able to like really see what like resources they could use, how we could help them, and plan to like work a lot more closely with those in the future. So that's definitely a benefit of them. And then switching to a recruitment update. So we had initially planned to recruit new practices in 2026, but Blue Cross Blue Shield has asked both MCT2D and all of the population health CQIs to hold off on recruiting new practices and POs in 2026 because, and you will likely know much more about this than I do, but it sounds like they're doing a lot of restructuring of PCMH, and they wanted the POs to be able to fully focus on that restructuring and alignment within that space versus worrying about getting new practices onboarded and up to speed. We're expecting to resume recruitment in 2027, dependent on Blue Cross Blue Shield. So it's not 100% a sure thing, but it looks like we'll be able to recruit again in 2027, and we'll let you know when we do know more about that. And then, as likely you know, due to the emails that we've been sending out with different polling, we're going to be hosting our PO small group discussions in February. These should all be scheduled before the end of the week this week. I think the majority of them are, and there's just a couple that we're working on aligning like a date and time for. We conducted these calls for the first time last year in lieu of PO one-on-one calls, and we got a lot of feedback that these were helpful and informational and nice to bring together the POs and learn from each other. So some of the topics that'll be covered are like supporting practices with the performance measures, engaging clinicians, using the dashboard and reporting tools, and the CGM data interpretation. Okay, a couple of questions in the chat that I'll pause to answer. So Kathy, you'd asked, does that include adding new providers to already participating practices? No, it does not. So the way that that works is, since the value-based reimbursement scorecards for MCT2D are done at a practice level, if there is a new physician that joins the practice at some point during this year, when we quote unquote like refresh the VBR in September, any physician that is part of the summer PGIP list right before we do those VBR calculations is considered as being part of MCT2D, since our participation is practice-based. So they will get essentially automatically added like to the practice and to the scorecards when we do that refresh in July. So that's not part of it. It's more the sense of like bringing on entirely new practices who need to get oriented to the collaborative and are on a different scorecard than the ongoing practices is more what they mean than individual providers. And the second question, is it possible to switch groups / times for the PO small group call? Yes, if you absolutely need to. We tried to group POs that we felt were similar to other POs within the collaborative so that, you know, the discussion and the different best practices were more translatable and adoptable. But do you know if you need to switch times, you can reach out to me and we can see if we can make something work. Like to the extent that we can, we want everyone to stay in the groups that we've organized you into and try to find a time that worked for everybody. But if you okay. All right, we'll see if we can find some different times. Caitlin and Gina will follow up with you separately for both of those. Give me 1 second to write a note to myself about that. Okay. So next, just wanted to give a brief update on some of our work groups that are going on. So we have a couple going on this week. So the EMR work group is taking place Thursday at 10 a.m. The primary focus of that will be for each EMR subgroup because we've grouped each person into what EMR that they work on and designated subgroups for those. We're going to talk about progress and goals for 2026. If you're not on the invite for this and it's something that you want to be a part of and join, you're absolutely welcome to do so. So please just send us an email if that's the case. Same with our advocacy work group. We sent out an email about that on Friday, covering what the agenda will be and how we'll structure that meeting. It's going to focus on discussion of advocacy goals and determining like what we're going to be focusing on for the remainder of the year. Same thing, feel free to send us an email if you want to join that and aren't already included on it. With our steering committee meeting, our next meeting isn't scheduled yet, but we'll likely hold it in the spring to review and sign off on the upcoming performance measures like we've done previously. And for the research committee, the next meeting is going to be on February 12th. It'll be the first working session. We had one meeting with this group where we did more of a broad introduction to what the committee is and how it will function. So for this next one, we're going to be focusing on how the committee will accept proposals for the use of collaborative data for research purposes. And I just want to spend this last little bit giving you an update on where we are with our pre-diabetes initiative since we had like our focus group meeting back in December and got some feedback from them. So this is a timeline of where we've been with the pre-diabetes work. So in March and April 2025, we went through like the feedback from different surveys that we've done with the collaborative, from the patient advisory board, from comments and input that we've gotten from collaborative members to think about how we may want to approach this. We then kind of confirmed some of those thoughts and like learned more about what the collaborative thought through some focus groups that we held in May. From that, we worked on a pre-diabetes screening guide that we distributed in July. That was something that the collaborative had requested via those focus groups and via the other requests for information on pre-diabetes that we've had in the past. And then in August, we began design work for our web platform that will be both patient and provider facing. We showed some of the screenshots of this at the fall regional meeting. So likely you've seen a little bit of the work that's been done on that, and we have some updates to share with that as well. We worked in December on defining what the patient population will look like for prediabetes, like in a very specific way with like the codes so that we can be sure that with that MDC integration that we're capturing all of the prediabetes patients. We've also, in the meantime, been working with NKFM, who has a diabetes prevention program and has been supportive of the work that we've been doing. And then we're hoping to launch our web platform and print tools at the regional meetings in April. So that's our target, is to have that ready so that we present these kind of to a captive audience of the clinical champions at the regional meetings. And then, like I previously mentioned, in June, we're hoping to launch the prediabetes population into the dashboard. Here's a little bit of the preview of the web platform that we're working on. So this is like what a patient landing page would look like. You can see there's like integrated components of this. There's videos, there's things where they can click. We have this metabolic matchmaker quiz that helps them kind of determine what interventions may be or prevention strategies may be right for them. So it's giving them personalized recommendations where they go through like what their health goals are and like specifically direct them. So very patient friendly and patient focused as far as making recommendations. We learned from the focus group some of the feedback that we got on these meetings. So the framing and educational content on prediabetes and metabolic health was really well received. The focus group members felt very good about that metabolic matchmaker quiz and the strategies that were shared like, as a result of that quiz. And then there was the request for ensuring that we have supportive like PDF and print versions of some of the content and other physical tools because a lot have brought up that there will be patients that aren't going to be as comfortable with using a web-based platform for some of this. So we're thinking about how to adapt that for those patients. So where we are with it now, we're continuing working on the web platform for launch in April. We're working on creating the PDF versions of those tools as requested. And you can see kind of a preview of like this 30-day habit challenge here. And then we are working on that data enhancement and translating like some of the specifications and code that we worked with to like what that extract will look like. And that's all that we had for MCD2D for today. Any remaining questions or about anything we covered, please put them in the chat. I'll make sure to follow up as far as the focus groups. And then we have our next PO monthly call dates in February on the 9th and 11th at 11 a.m. and then 2 p.m. on the Wednesday.
Thanks,
Okay.
Jen.